Chiropractic neurology combines chiropractic and neurology in a comprehensive treatment model that addresses all components of a person's injury. The brain talks to the body, but what a lot of people don't think about is that the body talks to the brain. And the brain requires that information to be accurate in order to process it and appropriately and accurately control the body itself. When this is interrupted, we have symptoms, we have pain, we have headaches, we have migraines, we have all of these types of symptoms that people experience that they come in to see us for. Chiropractic neurology isn't just looking at the joint or the muscle component of your injury or the site of the injury. We're looking at the connections that that area has with the brain. And so along this communication pathway, or how our joints and muscles talk to the brain, we want to address all the pieces and components of that so that we give you a comprehensive, full, complete recovery by addressing all the sources of your problem. With our extensive neurological training, we're able to focus specifically on neurological conditions as they come in as migraines or concussions or vertigo and dizziness, but we're also still treating musculoskeletal conditions extremely well through a neurological lens. And so we're providing better care for the musculoskeletal conditions by ensuring that we're addressing not only the muscle and joint issue, but its connections and processing in the brain, but we're also treating neurological conditions extremely well by focusing on the brain and nerves and adding in some chiropractic care when necessary to help with things like oxygenation or feedback to the brain about head position, things that are extremely important to combine both with, but we change the level or degree of how we approach each condition based upon what it needs. Some conditions may have more chiropractic, some conditions may have more neurological, but most conditions have some kind of combination of both, but they are weighted differently. So we can provide a very complete package of care to address all the portions of the complaint or condition that resolves the patient fully and long-term. Some of my favorite patients are those patients that come in who have been to a lot of places already. They have complex neurological conditions like vertigo, dizziness, concussions, migraines, and they haven't really been able to have any success with what they've done so far. When we approach these patients, what we do is we look for the source of their issue. And sometimes its source is, there's more than one thing. And because of the comprehensive approach of chiropractic plus neurology, we're able to look at all the pieces along the axis of what might be occurring with them. After developing that treatment plan and carrying it out, you see that partnership really come to fruition, where that patient starts to notice those symptoms changing, they're starting to feel better, we're feeling great about it, and that patient is seeing that they can regain their life again. Most of these patients can't work, they can't do their jobs very well, they can't play with their kids, they can't be the family person that they want to be, and we help them regain their life in that, and that really means a lot, and that's why we work so hard to educate ourselves and to have the right training for these patients, because we really do care about getting our patients better.